Thank you very much, Madam Speaker. Madam Speaker, first let me take this opportunity to thank my colleagues who have made several comments on the recommendations and the contents of this report, Madam Speaker. And Madam Speaker, the contributions that have been made in the floor of the House have added value to this report, and want to acknowledge that, Madam Speaker, because of the nature of the investigation, there could have been a lot of other issues that could have been captured, but we are happy that the honourable senators here have been able to bring out those matters very clearly, Madam Speaker. Madam Speaker, I'm particularly pleased with the recommendation by Senator Mungatana on the sensitization of the public in terms of being given capacity to be able to report where they feel that services have not been adequately rendered, or there have been cases of negligence and the members of the public don't know exactly how to carry them forward, Madam Speaker. Madam Speaker, in our course of investigation and looking at this matter, Madam Speaker, there is a lot to be desired in the processes of some of our facilities. And I want to say that what my colleague, the non-practicing gynecologist, the senator for Kakamega, alluded to, that MTRH has standard protocols. Then the question that begs to be answered, Madam Speaker, is how then could a whole national referral hospital with that kind of expertise and standard protocols fail to differentiate between a black seed and teeth, Madam Speaker? Madam Speaker, how would it end up that an operation meant to remove a black seed ends up removing 3 teeth, the third one meant to cover up for the failure of the operation, Madam Speaker? And Madam Speaker, therefore, when we made the recommendation, we took into consideration all the processes that already have been undertaken by KMPDC and MTRH, Madam Speaker. And Madam Speaker, what we would like the medical professionals to understand and know is that because we are all human, and sometimes some of these mistakes or errors are committed not willfully, but just mistakes that happen in the course of duty, Madam Speaker, it is extremely important that they become candid, they engage the families, and the hospital takes up responsibility and use the mechanisms that have been provided for in the regulation of the profession under the Kenya Medical Practitioners and Dentists Council. Madam Speaker, it is also good to let my colleagues know that KMPDC, other than the fines that are imposed, there are other disciplinary measures that can also be taken, including the suspension or total cancellation of the license, Madam Speaker. Madam Speaker, all these procedures are in place. What we want to urge the Kenya Medical Dentists and Practitioner Council and all other regulating agencies for medical practitioners or health workers workforce, Madam Speaker, is to make sure that they have regular supervision, inspection to assure the quality and the standards and the procedures that needs to be followed in all medical procedures, Madam Speaker. And Madam Speaker, I want to agree with my colleagues that we also make follow-up as a Committee for Health with the Cabinet Secretary for Health so that some of these matters can be averted. Madam Speaker, I was so saddened to see a mother carrying a child in an hospital where she had rushed to seek medical treatment, only for the doctors to ignore until we lost the child in the hands of the mother, Madam Speaker. I think it should also be made known to the public that even in an event where medical workers are on strike, the law requires that they maintain a certain minimum workforce to address the emergencies that arise, Madam Speaker, in those facilities. And I therefore want to assure the Senator Joyce Korir and the other colleagues that as a committee we are going to look into that matter with a view of taking action on the workforce, the minimum workforce that was supposed to be at work in that facility, Madam Speaker, to avert losses of life, even as the doctors and the medical workers seek justice for their fair compensation in the work they do, Madam Speaker. And Madam Speaker, health workers, even as they push for fair compensation for the work they do, they must also remain true to their oath, to the oath they took, Madam Speaker, in their practice, so that we don't lose lives and we make sure that work continues even as we see compensation. And I also want to say and let the medical workers know that the Senate Committee of Health, together with the National Assembly Committee of Health, Madam Speaker, have had serious engagements on looking at the issues that touch on the human resource for health, Madam Speaker. And Madam Speaker, this government is very proactive in terms of addressing all those welfare issues. Madam Speaker, you realize we had a problem with interns doctors. That matter now has been resolved. And all the other matters will be resolved progressively, Madam Speaker. And we also want to seek the indulgence of the medical workers, that they also become patient with government even as we address, and not to congest the system with so many demands every other day, but allow the processes to be concluded for each and every activity. This was a very unfortunate incident that should not occur again, Madam Speaker. And Madam Speaker, in our recommendation for compensation of the family, Madam Speaker, we made it very clear that there is culpability in the part of MTRH, and that of the doctors that were responsible, Madam Speaker, during the operation. We've also noted, Madam Speaker, that all facilities in this country are required to have a medical cover that indemnifies the workers, Madam Speaker. In an event we have such incidences, the insurance should be able to compensate. And we know there are so many Kenyans who have lost their lives through such processes, Madam Speaker, and they have not been compensated, while the hospitals have also paid for the medical insurance. And therefore, there are insurance companies that are profiting without the insurance actually being functional. With that, Madam Speaker, I wish to request, pursuant to Standing Order 66.3, I request that you defer the putting of the question to a later date, Madam Speaker.